We are also here representing the Ministry of Health, our Cabinet Secretary and our Principal Secretary in charge of Public Health and in the Ministry. Now, this is a very, very important forum from the fact that the Tobacco Control Act was enacted in 2007. And since then, there are quite a number of new and emerging products which have come to the market and which were not anticipated in the law. Of course, the law talks about tobacco products, but it is not focused on the new and emerging products because there are many innovative ways of the industry working on products that were not originally anticipated. But as the years go by, there are changes, and apart from the cigarettes, which were actually for smokers, now most of the products which are there which are in the market, smokeless. So we are in the process of actually relooking at the law so that we can see what we can amend and be able to bring on board things which were left out and the gaps which were there so that we can fill them in, and also essentially also to align the Act to the new Constitution. Since 2010, when the new Constitution was formulated, there's not been any amendments, and we are looking at a wholesome way of doing it so that we can bring all the interested parties, we bring them together so that we can be able to get a law which is going to cater for not only the cigarettes, but the new and emerging products, and even look at the future so that whatever comes in can be put in the loop. Now, this tobacco space has got several players. There are key players in it. And whether we like it or not, the Ministry of Health, whose mandate is to make sure that the health of our public is the most important thing that the Ministry of Health looks at and focuses on. But apart from that, in this same space, and that's why we have the Tobacco Control Act of 2007. You cannot have this act without looking at some of the key players. The tobacco industry is a key player in this because if they were not manufacturing or importing or exporting these products, then certainly we will not be here discussing tobacco and its products. We will not be here doing that. So as the industry is a key player, then we also have the other stakeholders. We have the civil society who have been working very, very closely with us to make sure that we are able to realize the goals of the Tobacco Control Act and the Framework Convention for Tobacco Control, the WHO. We've worked very, very closely with the WHO, who brought together member states who are signatories to the Framework Convention for Tobacco Control. And Kenya is one of the signatories. So are we a part of what the WHO had been advocating? Yes, we are. Today, the main focus is on taxation, but do we think, as a Ministry of Health, do we think that increasing taxes for tobacco and tobacco products, would it cause a deterrent? I would say yes, that it would in the tobacco use. But again, if you look at the Act, it is very, very clear. We are regulators. We are regulators, and being regulators, we have to make sure that in the market, the products which are there are meant not to destroy the health of Kenyans, but they are meant to, we need to have a balance between the public health of our people and also the trade, which is being carried by the tobacco industry. Now, if we increase, if the government increases the taxes, yeah, what does it mean in terms of the users? It will actually discourage the users. Quite a number of users will drop off on the way because the product will become too expensive for them to be able to manage. The ones who use a lot of these products then would have to reduce the amount of these products that they use, the tobacco products that they use. But if you talk to most of the people, especially the users, they would also tell you that the new and emerging products are helping them to get away from the smoking type of products to the smokeless type. But it has been shown that most of the people who use the smoking type of the products are the same people who are also using the smokeless types. So it's a balance that we need to look at, and as we are regulating, we need to look at a situation where what really matters is the public health of our people. So in the Ministry of Health, we are focused on that. In the board, we are focused on that. But I'm also asking all the players, and KRA being our agency for collecting the Solatium funds, and also collecting taxes in this country, because it's a body which is mandated to do that. KRA, as our partners and as our agency, and we've signed an agreement with them that they have to make sure that everything that comes into this country, any tobacco and tobacco products that comes to this country, and nicotine products, can actually be taxed accordingly, but also we should also get our Solatium fund from it, because it's a compensatory fund. Now, if you look at the market, if you look at the market, if you just go around, you'll see products which were actually not even, according to the Ministry of Health, we were not even aware that they were there. In other words, there are illicit products out there also. And once you have illicit products, it's very, very difficult to know what are the contents. Are these products conforming to what the law says? And we are going to, together with NACADA, we're working very closely to make sure that these illicit products which are out there, and also the Tobacco Control Board and the Ministry of Health, the division which is in charge of implementing our advisories, as we give the advisory to the Cabinet Secretary and the Principal Secretary, we want to make sure that the products which are in the market should be the products which the ministry is aware of, the products which have been registered, which we know are there in the market, and the illicit products, we should be able to get rid of all the illicit products, because those are the ones we cannot control and even know what they contain, and that is very, very dangerous to the health of our people, of our publics. Now, the National Taxpayers Association is a very important forum in making sure that we are able to walk the line and follow the law, so that the government can be able to regulate the products which are there in the market. The other thing that we do expect to see is, as the Solatium Fund is being collected, we are going to start rolling out cessation programs, and also rehabilitation centers in all the 47 counties. But what we have earmarked at the beginning is we are going to do these rehabilitation centers in 10 counties, those ones are the hotspots where the use of tobacco and tobacco and nicotine products are being used because all the reports have shown us where these hot counties are. So we'll start with the 10, but we intend to roll out in all the 47. And the Solatium funds, which KRA is helping us to collect, is just 2%. And that 2% is going to be very, very useful because it will also assist us in doing research and helping us to disseminate information and sensitizing the public at the county levels, at the sub-county levels, because there are some areas which are really known to be hotspots. So today here, as we are discussing and looking at the new and emerging products, we should be able to come out today, by the end of today, with information, and also, because we are here also to learn and say what the Ministry of Health is trying to do in this space, and also what we are trying to do to make sure that the health of our publics is safeguarded. So if the public all fall sick, for example, all the people who are using these tobacco products and they all fall sick, then the industry would actually die naturally because there'll be nobody to buy their products. But that's why we are saying we need to regulate as per what the law has said. Yeah. Now I'm here also with the...
Now there's industry, there's taxation, and the health. The policy right now, or the act the government or the Ministry of Health are put in place, is it enough to safeguard the health of the Kenyans?
I would say the law the way it is. The law the way it is, because it did not anticipate these new and emerging products. There is a gap. And that's what we are seeking to close that gap. And we are working very closely also with the parliamentarians, the Committee of Health in the National Assembly and the Committee of Health in the Senate. We are going to engage them. Of course, I have an advantage that I was in Parliament for 20 years. When this law was being formulated, I was a member of that health committee. There were a lot of concessions which had to be done so that we can get the law in place, because we'd been pushed to a corner and there was a possibility of us losing everything. So we had to negotiate, and the gaps which are there, we are going to address them. And we are going to involve all the key players in making sure that the amended law is going to make sure that the gaps are going to be closed by parliamentarians when we enact this law. Now, if you look at the younger people, you know, in the past, our grandparents and our mothers and our fathers, what they used to look at was the raw product of, just the raw product of tobacco. What you call mbaki? Waswahili tunaita ugoro. So those are the products which used to be used. Yeah? And you can see, when they were being used in that raw form, our elders had lived for long. But the more innovations are coming in, the more these products are becoming quite, I would say, dangerous to our people. Now, today, if you look at it, it is the younger people. They think it is trendy to use the new and emerging products. They think it is trendy to smoke. The older people are leaving the habits, yet the younger people are being looped more because of the more innovative ways of marketing that the industry is also using. So I do believe that the law which is there, as it is today, we are trying to close to meet the needs and the new emerging products. But finally, we will have to do that amendment. Once we do those amendments, certainly, we will be able now to loop in everything. But meanwhile, we are going to do the surveillance. We are going to do on-spot and sting operations. We are going to make sure that we do not have any illicit products, or we do not have products which are not meeting the standards which have been set in the Tobacco Control Act. With me here is Dr. Toro, who is the head of the division, which is in charge of implementing what we've advised the Cabinet Secretary and also the Principal Secretary.
You've talked of isolation fund.
Solatium.
Solatium?
Solatium fund is a compensatory fund which KRA as our agency is collecting from the manufacturers of tobacco and tobacco products, the importers, and the exporters also of tobacco and tobacco products. So it's a special fund that has been kept there as a compensatory fund to assist the Ministry of Health to be able to not only just regulate but control the use of tobacco and tobacco products.
Secretary, yeah. Is it possible to know how much is in that kit right now, and how much has gone to the Ministry of Health, and how much the Ministry of Health is passed outside there for control?
Okay, what I can tell you...
Especially on NCDs and cancer treatment, because you've just only mentioned research and public communication. So we also want to know, the Solatium Fund, how much has it been used maybe to mitigate the effects like those in NCDs and also in cancer?
In the law, it gives the Cabinet Secretary room to expand the uses of the Solatium Fund. Yeah. So, and the administrator of this fund is actually the Principal Secretary in charge of public health. Okay. So that way, as the implementers of what we have advised, the Cabinet Secretary and the Principal Secretary, the implementers is actually the Ministry of Health itself. And there, they sit down and look at it and tell us how they would want some of these funds to be utilized. Apart from the law, there is the bit where the Cabinet Secretary is allowed to make a decision on how these funds can be utilized. And since the administrator is the Public Health Principal Secretary, they usually come back to us. Now, I just want to tell you, this money, although it is collected, when it is collected, it goes to central bank. When it goes to central bank, it is not added to the consolidated funds. No, it is a standalone fund which has got its own account, a collection account, and in that fund, you cannot use all the money which is there because appropriation is done through the budgeting system. So like last year, I would just want to quote last year, because I've not looked far back, but last year we were allowed to use 756 million. But I can tell you we do not even use a shilling because we wanted to streamline how the funds are going to be utilized. So as a board, we sat down with our Principal Secretary, who is the administrator of the fund, and we agreed on how this is going to be done. So you can only utilize only what has been appropriated. You cannot go further back. So last year it was 756 million. We didn't use it. This year, we've been allowed to use, this financial year, we've been allowed to use 831 million. But as a board, like I say, we are not, we usually use the Ministry of Health to implement what we are going to put and agree on the annual work plan. So that is what we are working on. Even as I speak today, we've just entered the second quarter of this financial year, but we've still not even used a shilling out of the 831 million.
What's the reason behind that?
The reason is, it's very, very simple. We wanted a way that our agency, we were going to stop the habit of them going to the industry, depositing money directly to any account, because even following up and checking whether somebody has deposited or they have not deposited became very, very cumbersome. So what we did, we said, let KRA collect, make sure that the money goes to central bank. Then from there, our Principal Secretary now can apportion the money the way it should be apportioned. That's the way we are working on it. Yeah, but otherwise, the ministry relies on our advice on even how to utilize the funds because it is there in the law. Yeah.